As we move forward into this year, we are all reminded of the importance of taking care of ourselves and people around us. But as we go on, many families continue to suffer with one of the biggest health challenges: cancer. It affects many people's lives and hearts, but some of these effects can be prevented through awareness, early detection, and healthy choices. Let's come together as we talk about the National Cancer Prevention Month by spreading awareness and steps to protect each and every one of us. I'm Dumat Yenzo, your host for today's episode of Lifeline, where we improve our lives by feeding our minds. Joining us today is an academic staff of the UST Faculty of Medicine and Surgery, Department of Medicine, Clinical Epidemiology, and Medical Ethics. Let us welcome Dr. Clevelinda Calma. Hello, welcome po.
Good day. Good day, everyone, to your viewers.
Yes, welcome to Lifeline, Doc Bing. We are glad to hear your expertise about the National Cancer Prevention Month. So how are you feeling po for today? Good.
Good, always.
Yes, so we're really excited to have you here. So let's jump right in with our questions for today. What is cancer and its types?
Cancer is a dreaded word, but it refers to the unopposed proliferation of cells, no? And this proliferation or over-proliferation is what forms the tumor. So in short, cancer is a malignant tumor. Malignant meaning it has the risk of either spreading to other organs or, if in the first place it has been removed, of coming back.
For our next question, Doc Bing, how does cancer develop and progress? And how is cancer classified into stages 1 to 4?
So cancer develops, as I said, as unopposed proliferation of cells. And this is because of many things. The most common knowledge about the progression of cancer is it going through different mutations and changes in the genetic material brought about by exposure to external and internal factors. So as to the classification, there are several, no? But it can be classified based on the site, meaning kung saan siya nanggaling or saan siya unang nakita. So you can have breast, lung, colon cancer, gastric cancer, as it refers to where it originated from. Or you can also classify it based on the histology or how it looks like under the microscope. So it can either be adenocarcinomas, squamous carcinoma, sarcoma, etc. When you say the numerical classification, it actually refers to stages, which is based on tumor size, tumor invasion, and then nodes or lymph node involvement, and the presence or absence of metastasis.
Okay, thank you, Doc Bing. In relation to you discussing the types of cancer, no, what type of cancer is prevalent in terms of morbidity and mortality here in the Philippines?
Sige. Siguro I'll talk about the top 3, no? The top 3 in the Philippines, number 1 is breast, and then followed by lung, and then colorectal cancer. Unusually also, we see a lot in the Philippines and in Asia of liver cancers. Yung top 3 are breast, lung, and colorectal.
Breast, lung, and colorectal. So we're only at our first set of questions, and I'm already learning so much, Doc Bing. Thank you. And now we will proceed in spreading information and debunking online health myths for Lifeline segment, Quick Fix or Crisis. For our first question, cancer risk applies only to people with a genetic or family history of the illness.
Crisis.
Why is that, Doc Bing?
Primarily, we see a lot of what we call sporadic cancers, meaning no known family history, and they're the first ones in their family. So this is about 80% of patients. So
Okay.
that's a crisis.
It's a crisis. Okay. Next, cancer can be diagnosed through the color of the skin, nails, or tongue. Quick fix or crisis?
Crisis.
Crisis. Why is that?
Primarily because those are warning signs, but they don't mean cancer right away. So to really say it's cancer, we need the histology or a biopsy.
Right. Okay. For our next question, will avoiding smoking, vaping, secondhand smoke, and pollution help lower cancer risk?
Definitely quick
Quick
fix.
fix. Can you elaborate more on that, Doc?
Because as I said, cancer develops because of exposure to either external or internal environment, and removing the possible external sources of the mutations can definitely lower the risk of developing cancer.
Okay, thank you so much. And I think this is the last one. I'm excited to hear your answer for this. Can eating lots of lemons, honey, and garlic actually cure cancer?
Crisis.
Crisis.
So there's not one remedy or quick fix. So there's not one quick fix for preventing cancer, but it is advised to eat everything in moderation, because everything we know that a healthy lifestyle will help in not only curing but actually preventing cancer.
After distinguishing the facts and myths about cancer, we actually still have more questions, Doc Bing. Are you still ready? Are you
Yes.
still
Still
here?
ready, still
Yes.
here.
Okay. What are the first signs or symptoms an individual often experiences that could lead to cancer?
Okay, we use mnemonic for it, no? So a change in the blood, in urine or bladder or bowel habit, a sore that does not heal. Um, if you have a obvious change in wart or a mole, a thickening or lump in your breast, if you have indigestion or difficulty swallowing, you have unexplained weight loss, you have unexplained anemia, or a persistent cough or a persistent hoarseness of your voice, then those may be early signs or symptoms of cancer.
Doc Bing, for our next question, how early can cancer be detected with the current screening methods available?
So, cancer screening means it's for everyone. And today there are only several cancers that can be screened. So, one is breast, so which is good because it's the top cancer, no? So, mammo, there are several methods, but mammo is the most validated. And then there's colonoscopy for colorectal cancer. In those who are at high risk, there's for prostate cancer, there's PSA. Again, it would vary as to the when to start it. And then for those at high risk because of certain lifestyle factors and genetic factors, there's also now screening for lung and for the liver. So the people who will benefit most from these screening modalities are varied, and therefore it is best that you ask your physician or your healthcare provider or healthcare advocate as to what is the best screening modality that will benefit you.
Okay, thank you so much, Doc Bing. Now, I would like to know, no, what can individuals do, like us over here, so that we can avoid developing the risks of cancer?
Okay, some risks are inherent, meaning it's something that we cannot change: age, sex, genetics, family history. But there are other risks that can be modified: smoking, lifestyle factors, smoking, what we eat. It's early on, but there are some. Also, when I will talk about smoking, no, there are also already some initial studies saying that vaping can also increase your risk for cancer. So I'm talking about that because I know that there are a lot of young viewers who may say, I don't smoke, but I vape. So vaping, avoiding vaping, smoking, sleeping well, eating the right food, meaning more vegetables and fruits and lesser of the fat and meat, and moderate exercise or moderate activity.
Okay, now getting into your advice on, living a healthier lifestyle, what are the dietary restrictions that people should look into if they want to reduce the chances of developing cancer?
I always say it's not restriction, but modification, meaning choosing food that are healthy, meaning more fruits, more vegetables, lesser of the fat, of animal fat. But everything should be taken into moderation. In reality, there's really no food that should not be eaten or consumed to reduce the risk of cancer. It's really everything in moderation, with, of course, the other lifestyle modification.
Yes. Okay. Thank you so much, Doc Bing. Now, I would like to know, onto a much larger scale, how can we, here in UST as universities, workplace environments, and other institutions help take proactive steps in advocating for early detection of cancer?
Okay. I think it's we all of us can do something, a little thing to help in the control of cancer or prevention of cancer. So, number one is knowledge, because knowing how to prevent it and knowing what it is will help us take action. And then little things like going on social media, providing the correct content, advocating for others, sharing your story or the story of others. And when I say sharing your story, make sure it's verified. And when I say sharing your story, make sure it's your story or your family story to share. Otherwise, it's not proper. Anything, no. If it's something that you feel like you need to do, go to Congress, go to the Senate, and advocate for screening programs. Anything, any small thing means a lot in the grand scale of things.
Thank you so much, Doc Bing, for answering all of our questions. And I'm sure that a lot of our viewers over here, like me, has gained a lot of information and knowledge. Kahit na hindi ka nga medical health professional, you can still help spread awareness and their correct information through the use of internet or media. So, is there anything that you want to share with our Lifeline viewers, Doc Bing?
Oh, thank you also for the chance, no, to be on this platform. Kasi number one is be informed, get the right information. I think that's the start. And then cancer is 1/3 treatable, 1/3 preventable. So with the knowledge that I hope you learned, kahit konti, you'll be able to work towards that goal of treating, preventing first and then treating cancer early.
Thank you, Doc Bing. This month of February, we do not only celebrate the love of a partner, friendship, and family, but we should also cherish the gift of love by taking and showing care. Cancer is widespreading, yet surely it can be battled in the simple yet impactful acts of reminding and sharing information to every person around us. This ends another episode for today. Once again, I'm Dumat Yenzo, and this is Lifeline, where we improve our lives by feeding our minds.